My name is Fendri. I'm currently the director of SGPP Indonesia. And before we start, I'd like to introduce His Excellency Kim Chang-beom. We are honored and grateful to have him here. And he has had an illustrious career as a diplomat. He has served and been posted in many countries. Among them is Japan, the United States, Belgium, and of course, Indonesia. And he will be talking about an issue that is, of course, of global concern right now, which is about the COVID-19 pandemic. So we are living in unprecedented times in which our way of life has changed, drastically changed due to this pandemic. And the world's governments have had different responses toward this pandemic. Some have played it down, some have taken really extreme measures, and some are in the middle. But nevertheless, there are countries that have successfully curbed the spread of the pandemic. And one of them is, of course, the Republic of Korea. And in his talk, His Excellency will share with us about the precautions and the things that have been done by Republic of Korea in curbing the COVID-19 pandemic. So without further ado, Your Excellency, I'd like to invite you to give your speech. Thank you very much.
Thank you so much for inviting me at this online public lecture to be organized by the School of Government and Public Policy. I'm quite delighted to see all of you on this wide screen. And thank you so much for selecting the topic, which is on how Korea deal with COVID-19. And as of today, actually, we have about 10,204 confirmed cases and 186 deaths. For the first time since the peak period, which is about late February, we have reported 47 cases. The first time ever that it is below 50 new coronavirus cases. And currently about more or less 80% of fatalities, I mean the deaths are occurring in patients who are 70 years of age or older, which is a bit quite a bit assuring for young millennials. But I think there's so far no one below 29 years of age have died in Korea due to COVID-19. Of course, we are still fighting this battle against COVID-19. And we are all collaborating and cooperating with each other. But I think this today I would like to share with you what we have done and how we have dealt with this common enemy, which is coronavirus, and also how we could cooperate together, especially between Indonesia and Korea. Let me just show you one chart. Actually, this is the kind of the topic of the day. There's the peak time is more than 900 new cases late February, but it has been a bit flattened ever since the middle of March. I think that has given us a bit of global kind of praise for the measures that Korea has taken in combating this battle. And Korea has adopted a unique model for responding to the COVID-19 outbreak. The key tenet of our model can be defined as kind of dynamic response system for open and democratic transparency. The two core values of our approach are transparency and creative thinking. In our fight against COVID-19, we took a holistic approach, whole of government approach. In fact, our central anti-disaster headquarters, which is more like a task force, is being chaired by the Prime Minister. And not only central government officials, but all the local and provincial government representatives are all included in that central anti-disaster headquarters. And also the President Moon Jae-in is now chairing Emergency Economic Council every week to tackle the emerging economic difficulties and challenges, to provide some stimulus packages and measures, and to support mechanisms to assist the businesses affected by the pandemic. We are also following recommendation of WHO, World Health Organization. From the very beginning, we have taken the path upon the recommendation of WHO. For example, none of our cities are cut off from the rest of the country. There have been no regional lockdowns, only full-scale efforts to contain the spread of the disease. We have not placed any complete travel ban on any foreigners except those who are coming from, at the very initial stage, from the city of Wuhan and Hubei province of China. These kind of approaches and responses can be summed up into 4 strategies. First, aggressive testing. Second, vigorous tracing. The third, treating those infected at the earliest possible date. And last but not the least, actively engaging the public. Let me just go through these 4 strategies one by one. First, aggressive testing. Our robust diagnostic testing capabilities lies at the core of our fight against COVID-19. We can test up to 20,000 cases per day. So far, we have performed a total of 466,000 tests thus far, as of today. By the end of March, 1 in every 130 persons in Korea was tested. And we continue to pursue this aggressive testing at full capacity. We have also introduced innovative measures for safe, quick, and convenient testing. Let me show you one. This is quite globally popular photo. It is called drive-through testing stations. This testing station allows drivers to go through the process of registration and testing in under 10 minutes. This method cuts time needed for sample taking and protects the medical workers and those waiting to be tested. No need to fog the area or wipe the tables or chairs with disinfectants every time, as no one gets out of their vehicles while being tested. Second, tracing. We use various methods to track and treat those who have been in contact with confirmed cases. Credit card transaction history, CCTV footage, smartphone apps, and mobile phone GPS data are some of the methods we use. Relevant information is then disclosed to the public so that those who may have crossed paths with confirmed patients or cases may also get themselves tested. Third, treating the patients, which is quite crucial. COVID-19 infection may manifest with little or no symptoms. So we consider early detection and intensive treatment at earliest possible stage as key. And we divide our patients into 4 groups: mild, moderate, severe, and extremely severe, according to their symptoms. Mild ones are accommodated in temporary renovated corporate and public facilities, which is called living treatment centers. Patients in other 3 categories are immediately put under hospital care. We have 67 COVID-19 exclusive hospitals and 139 living treatment centers. So basically, we have a quite sophisticated healthcare system to support this kind of approaches. Fourth, civic awareness and participation. In our case, transparency and high level of public trust were pivotal in implementing the nationwide practice of social distancing. The more transparent the government became, the more the people trust the government. People also acted quite responsibly and rationally for the common goods. Many took voluntary self-quarantine and other preventive measures, such as social distancing, that has effectively slowed the spread of the virus. Well, with that kind of approach and kind of all-out efforts we made, Korea is increasingly attracting global attention and earning international praise for its fast, effective, and tech-driven response to COVID-19. For example, Secretary General of WHO, World Health Organization, noted that Korea has shown examples. He said that Korea was faced with accelerating community transmission, but Korea did not surrender. WHO has recommended other countries with community transmission is to apply the lessons learned in Korea. Nowadays, you can find as many as articles and reports on Korea's response to COVID-19 as articles on K-pop or K-pop idols in Indonesian media. Korea's ongoing fight against COVID-19 is cited as one of the best models that democratic countries like Indonesia can consider and perhaps learn. Korea has overcome the worst phase of the spread of the virus so far. As I told you that for the first time since late February, we have managed to have this new cases below 50 cases. And we are prepared to share all information and know-how that we have gained so far with other partners around the globe. Indonesia is, of course, our priority country. Korea is sharing experiences and knowledge gained thus far with Indonesia. I firmly believe that our solidarity and cooperation will enable us to defeat our common enemy, which is global pandemic. Just recently, just last week, Korean government has announced 3 priority countries for humanitarian assistance and export of medical products related to COVID-19. To no one's surprise, Indonesia is the one out of 3 countries that we have designated as priority countries. So we are now discussing with Kamalu, Minister of Foreign Affairs, and other concerned ministries on how to cooperate with each other. And of course, we will soon announce government-to-government cooperation package especially to assist Indonesia's emergency health needs. Especially, we are thinking of providing some medical and quarantine items for the Indonesian government. And also many Korean companies operating in Indonesia are now showing interest and willingness to support the people of Indonesia in their fight against COVID-19. Just last week, 2 Korean companies, LG Group and Korea Midland Power Co., have announced their plan to donate testing kits. Testing kit is not a rapid test kit, it's a PCR based and protective gears to Indonesia. I hope more Korean companies will follow suit in the coming weeks. And the COVID-19 situation in Korea is relatively gradually stabilizing through preemptive and transparent major prevention and voluntary measures by our people. And together with President Jokowi and President Moon, took part in the extraordinary virtual G20 summit last week. to advance coordinated global responses against COVID-19. At the meeting, both presidents, President Jokowi and President Moon of Korea, emphasized the need to work together to share our successful responses with international community. And we are in close contact and collaboration with Indonesian government. But I think that this battle against COVID-19 is still on an uphill one. And we hope the legacy of COVID-19 to be one of global solidarity and better preparedness for the future. We hope that we not only maintain, but cherish and strengthen the principle of openness, civic engagement, and transparency in our battle against COVID-19. And I will stop here. Some might have not fully heard well. This is kind of the snapshot of what Korea did and how Korea deals with this COVID-19. And perhaps through the Q&A sessions, maybe I'll be happy and delighted to share with all of you more thoughts and more insights and perhaps more lessons to be exchanged. Terima kasih.
Hello. Annyeonghaseyo, Mr. Kim Chang-beom.
Yes.
I
안녕하세요.
want to ask regarding the testing method implemented by Korea, which is the drive-thru that you already mentioned before, because I heard that this testing model will be applied in Indonesia. I want to ask regarding your opinion, is it possible for Indonesia to apply this test quickly? And other things like, I feel like now government are preparing the social distance than the applying the test method itself. Thank you. Kamsahamnida.
Terima kasih. Well, I believe that every country has different conditions and different capabilities, as well as its own distinctive economic and social challenges. So every country has its own kind of different approaches and responses. I must say that there's no one-size-fits-all kind of solution. So Korea's case a bit recommendable, but Korea's case cannot be duplicated in the exact same manner here in Indonesia. Indonesia is much larger in size and population, and also is vastly located and geographically scattered, and the also level of public healthcare system. So, but I think that's we are very much committed to assisting Indonesian government's efforts. That's why we will be providing some medical supplies and quarantine items for the Indonesian government, and also some of the Korean companies are also in line to assist those Indonesian government's efforts. One thing maybe I just want to share is that in our kind of the efforts and battles against COVID-19, the most conspicuous strategy that we have undertaken was test, and test more. I think that those the kind of strategy, we call it 3T: trace, test, trace, and treat. That was the main pillar of our strategy. So in order to tackle these upcoming challenges coming from this COVID-19, I think this is quite crucial to secure sufficient testing capacities to first identify the cases and also to start trace those potential and vulnerable kind of sources of infection. So those are the points that I want to share with you, first of all.
Good afternoon, His Excellency.
Yes, good afternoon.
I'm Iskandar from Indonesian Institute of Sciences. Currently, we are researchers in research institution in Indonesia, and now we are appointed by the government to be a task force COVID-19, as you know. Yeah. I want to ask you how or is there any possibility to collaboration between Indonesia and Korean medical institution maybe to make some or to tackle this issue about the COVID-19? I mean, like how to make a collaboration between Indonesia government with Korean institution, maybe government or private institution. Thank you.
Terima kasih, Bapak Iskandar. Thank you for joining us. Well, that's I think that's your institute has a long-standing partnership with some of the Korean research institutes. I think, but especially with that, the COVID-19 challenge, I think there is more need for both research institutes of both countries to explore more opportunities and joint kind of program that they could work out. I think that's maybe it's a bit specific question, so that maybe I will ask Bapak Safendri to share with you our email addresses, so that you could directly get in touch with our embassy, so that we could do what we could do together. Of course, this medical and research institutes back in Korea are all preoccupied with the addressing the daily needs and challenges. So I'm not sure whether we could develop any kind of this joint program to under which your institute can work together with Korean counterpart research institutes. But we'll see. Of course, there's we are now collaborating not only for the near-term and short-term common objective, but also for the mid and longer term as well. Thank you.
Hello, good afternoon, His Excellency. Hello.
Yes, please go ahead. Yes.
Hopefully you're stay healthy in this pandemic situations.
Yes, sama-sama.
Sama-sama, terima kasih. I have one question regarding to my industry. I'm actually the practitioners of creative industry here in Indonesia. And besides, we're facing the hard situations in health area like COVID-19. We also face the difficulties in economic stability for the creative industry workers. I would like to ask questions how South Korea tackles the issues of creative industry workers. Is there any regulations regarding their welfare in these critical situations, His Excellency? Thank you.
Well, there's thank you for the question. This public health crisis is now affecting every spectrum of the whole society. So there are no exceptions. This crisis is not only targeted at the health and the well-being of the people, but also the whole economic life, and also even the industrial ecosystem is now being affected by this global pandemic. Well, I'm not sure whether we have any specific categories or the group of packages exclusively dedicated to creative industry workers. I think that's we are now introducing a broader relief packages for those who are being directly and severely affected by the economic difficulties include from this the coronavirus pandemic. And we are now planning to introduce kind of economic the relief package for those who are under middle income households. I think that that's one. And we, unlike other countries like China or Italy or some other countries, we have not implemented any full and complete or regional lockdowns. We are trying to implement very intensive social distancing policies, try to prohibit any mass gatherings, and also we have closed down the schools and gyms and some of the entertainment spots, but still we are trying to promote essential economic sectors to perform as they are and they used to be. So I think that's in order to maintain at least a certain level of economic activities, and also to allow less and less people to be affected by this difficulties and isolation in a sense. So I think there's those who are in the creative industry sectors. I think there's some might be more accustomed and more suitable for so-called work from home. Some might not. So I think that it depends upon the sectors and depends upon the people and professions. But I think that's we might have to come up with some solutions and some packages dedicated to special sectors. But as of now, we do not have any specific categories dedicated to creative industries. Thank you.
Why is Indonesia one of the top 3 priority countries? And what other forms of aid is the Republic of Korea going to provide for Indonesia?
Well, that's just in one word, Indonesia dan Korea adalah teman sejati dan sehati. We are enjoying a very uniquely close partnership, which is called Special Strategic Partnership. Indonesia is the one and only country within 10 ASEAN member states to be designated by Korea as special strategic partner. So that is illustrating why Korea has designated or listed Indonesia as one of the 3 priority countries that Korea will be extending its humanitarian assistance and medical supplies to. And we are now discussing with the Minister of Foreign Affairs and BNPB on what kind of items will be shipped in to Indonesia. Currently, in the pipeline, we will be providing the battery rechargeable disinfectant sprayers for Indonesia. And then also we are now discussing possibly the real-time PCR testing kits. Of course, we have to make it all concluded as soon as possible in order to ship those items back to Indonesia.
Okay, good afternoon, Mr. Kim.
Yes.
So actually, there are 2 questions that I want to ask. Is it okay if I ask two of them or just one?
2 questions will be okay. Yes.
Okay, thank you.
Buy one, get one free.
Okay, so actually, as we all know that the number of the people in Korea who got infected corona is higher than in Indonesia, but the problem is that in Korea the people in Korea still can get the mask, and there's no people like the panic buying. But in Indonesia, it's not higher than Korea, but we are difficult to find masks, and there's so many people who gather all the masks and sell it in high price. And there's one thing that I'm really curious: how did the government control the people not to due to mass gathering or due to panic buying? Because also my Korean friend said that in Korea right now, it's just like it's get back to normal. So I'm really curious about that one. And also the second question is that a few days ago, I heard that the Indonesian government wanted to release the people, the prisoners, especially for the corruptors, in order to decrease the risk of the spreading of the COVID-19. But how about in Korea? Is there any policy to release the prisoners or something like that? Thank you.
Yep. Thank you for the questions. Well, let me first touch on this mask shortage and panic and also panic buying in Korea. We do have the quite severe mask shortages at the beginning, and demand for masks have skyrocketed, very sharply increased in South Korea. It's beyond our production capability. So that has required the government to intervene. So the government has started to introduce a very strict rationing. It's kind of a public distribution of mask purchases from pharmacies and drugstores across the nation. Under this rationing system distribution measure, people can buy up to 2 face masks a week at pharmacies and drugstores. They are divided into 5 groups, depending on the year of their birth. So each group is assigned a specific day of the week to go and buy the face mask. At least so, every Korean, they are entitled to purchase at a very reasonable price. It's a government-controlled price, 2 face masks a week at least. Of course, there are other stores and online shopping outlets to sell masks a bit higher price, but at least at a reasonably controlled price, every citizen is entitled to get 2 masks per week. So that is actually has given a bit of sense of relief to those who are in need of masks. And about the why Korea didn't go through any panic buying, I think that your friends might have shared with you that there's still a quite full of stocks at the shopping malls and supermarkets. And unlike some of the countries where the panic buying has almost emptied the whole shelves of the supermarkets and grocery stores. Perhaps this is a public trust that the supplies of those groceries or the items to be needed for their daily lives will continue to be supplied, continue to be provided by the manufacturers. And also it is kind of the government policies to make an intervention into any kind of illegal hoarding, illegal purchasing in a massive scale of some essential items that has prevented any kind of hoarding of goods in advance. And perhaps another is kind of it's a bit of cultural kind of the gene or the tradition that Koreans are normally, that have some tendency to avoid causing troubles to others. So that might have also positively affected the very little sense of panic buying in Korea.
Good afternoon, His Excellency. Thank you so much for sharing and making your time to explain to us on what you did in the back home in your country. My question is about the second wave of COVID. How, because now, as I read in the publication and also in the media, that the COVID-19 peak is already over for your country. My question is, how do you make sure that the economic activity of the people still carry on? Because you are also, South Korea didn't really apply on the lockdown concept. How do you make sure that the economic activity can still carry on by, with also still mitigating the risk of the second wave of COVID-19? I think that will be all. Thank you.
Well, thank you so much for, it's quite crucial kind of challenge that we are all faced with. First of all, it's too early to tell the peak has arrived, even in South Korea. It's too early to be complacent. We are of the view that it is too early to be at ease. Our goal is to able to control infections in a way that our health and medical system, including personnel and sick beds, can handle them as usual. Now, still, it's beyond our usual level of this kind of handling this health crisis. And we, according to our Ministry of Health, if the number goes down to 50 new cases or lower per day, actually today is the first day.
Oh, wow.
Yeah, we reported 47 new cases. First time ever since late February. And late February, the number of cases per day was almost over 900. Wow. So after about 40 days that we are now almost reaching the level of 50 or minus plus. So we feel that number, 50 or lower, could be a bit of the good criteria, but still, we are now witnessing new cases and more infections, especially at some of the localized hospitals and where these people are getting together in a massive way. So we feel that our intensive social distancing policy should continue. So we have actually extended another 2 more weeks up until the 19th of April. And also we are still closing down the schools, but we may have to resume our schools from sometime, according to the press, is about April 9th, but initially we'll be starting online classes at the beginning, even though the school will be reopened. And another aspect is how to deal with economic impacts, especially it's more than impacts, actually it's more like a shocks to especially small and medium-sized companies and the mom and pop stores. They are badly affected. So I think that's while handling this public health crisis, but also we have to deal with economic crisis.
Right.
So that's the kind of the double track approaches now being taken by the Korean government. Of course, that we have initiated a supplementary budget, especially to be dedicated to medical and health needs in the wake of this coronavirus. And then also we have started to introduce the huge economic stimulus packages, or more or less about $40 billion that would be pumped into small and medium-sized enterprises at the beginning. And those are the kind of the similar packages that we'll be introducing this week.
Any forecasting that you made, when is this going to, kind of slowing down or end?
But the sooner the better, of course. But you never know, because the Korean government is trying to encourage our people on the street to still to stick to social distancing, because we know that people are a bit now exhausted, a bit frustrated,
Yeah.
a bit bored, being locked in their rooms and offices. But I think that's we are still in this fight. So the fight, we have to be perseverant and enduring, in a sense.
안녕하세요, 대사님. My name is Sabian. Actually, I've been living in Korea for the past years, but then I back to Indonesia because of coronavirus spreading. I actually have two questions about this one. As the first one is, one of the end solution to have to battle corona disease is by having a vaccine, but then it's still said that it's still gonna take a long period of time to get the vaccine. So otherwise, because of that, we would have to accept this life as the new normal way to live. So how is Korea plan to fare until the vaccine is found? That's the first one. And then the second one is more personal question for me. It's about regarding my depart back to Korea, because I've heard the new policy for the foreigners that are coming back to Korea, and they have to do a self-quarantine for 14 days.
Yep.
Could you share or elaborate more on the step that I will go through once I landed in Incheon?
Well, let me just answer the second question first. I think
Okay,
it's a bit technical one, and especially it's a very kind of personal issue that you have to.
Because I got really worried
So
about
you're
that
studying
one.
in Korea, or you're studying, or?
I was studying and then I work, but then because of Corona, my company is being closed for 1 month, so I got to go back to Indonesia.
Sorry to hear that.
Yeah,
well, so we, as I said before, we do not have any complete travel ban on any foreigners of any nationality. We are now strictly applying the so-called special entry procedures for foreigners who are coming into Korea. As you have said, it's a 14 days self-quarantine if you do not have any symptoms. Of course, with symptoms, you might have to get a test. In Korea, we are only applying real-time PCR test. We do not apply any rapid test. And that then within 2 or 3 days' time, you will get the result. And in the meantime, those who have symptoms, they'll be put into hospitals and then these into isolation for some time. And for those who not having any symptoms, they will be staying at their, I don't know, dormitory or house that you'll be, your addresses will be with. And then you are also advised to download so-called mobile self-diagnostic apps. It's a smartphone application. So when you are entering into Korea, you'll be submitting health declaration forms, and then they'll be advising you to download on your smartphones mobile self-diagnostic apps. So that is, you have to check your temperature and fever and some symptoms every day, and you are supposed to type up your symptoms every day. It will be directly, instantly transmitted to the headquarters. And also there is a caseworker who will be in touch with you if you have any symptoms or so. There's a kind of the smartphone based device or the application through which the government or local government or local health authorities are trying to trace you, but with only the mobile phones. So that would give you a bit of sense of the stability in a sense, because someone from the local health authority is looking after you when you have some fevers or some symptoms. Then through that smart devices, you can be connected.
Oh, so I can just go back to my home even though if I do not live alone, because I live in an apartment with my friend.
Right. Yeah, but you have an address of that apartment that you have to declare the exact specific addresses. If that's one, and the first one was about the what was that? I forgot that. Sorry, I was too focused on the second question.
How does Korea going to plan? How Korea plan to fare until the vaccine is found? Because
exactly.
Like
Yes.
my company right now is it's in the exhibition field, which is it's the mass gathering kind of event.
Right.
So it's all being canceled. So that's one of the reason why I've been put on paid leave until now. But then, you know what? It's gonna take a long time to get a vaccine. During those time, how does Korea going to plan on, to make more better?
Well, that's I got your point. I think there's still is quite a long way for the vaccine to be available for the general public. So it may take some time. I think there's many of the biotech companies are now racing against time and trying to come up with a solution. So I think there's with or without vaccines available, I think there's what the Korean government is trying to do at this time is that maybe that's the one that I've already explained to the friends. I think there's we try to minimize the number of cases as much as possible, so that either 50 new cases or below, that is something that we want to succeed in managing. And then we will see how this intensive social distancing policy will be reviewed after assessing the whole public health situations. I think that's so. With that, the social distancing policy either being loosened or a bit downgraded, then your company might have some chances to reopen their business. But I think that's still it's quite difficult to tell exactly when that point will be. But at least I think that's why I think there's every country is now struggling to stabilize the whole this outbreak. Yes.
Yeah. Hello.
Yes.
Go ahead.
Yeah. Good afternoon, Mr. Ambassador. Yeah,
Yes.
I would like to ask you about about the question as you say that this COVID-19 pandemic is not only issue about health but also economically and socially issue. It affects in economic and social sectors.
Right.
And it has been told by the other participants that Indonesia now faces not only about social crisis, economically crisis, but also logistically crisis. Not only about mass and the others, but also about maybe rice and other food logistic. Do Korea also face this issue, and how about the distribution in some area? And I have read that some area in Korea, like Daegu, has been quarantined for some times. And is there any problem in transportation and interconnectivity issue in interconnectivity sectors? If yes, how do the Korean government face those issues? Only that question. Thank you.
Thank you. Well, there's when we were tackling this, the enormous challenges coming from COVID-19, our more or less, relatively speaking, kind of the successful and effective handling of this crisis are mainly, I mean, thanks to the people of Korea and their participation, very active participation, and very responsible behaviors. From the first days of the emergency, Koreans have been showing great civic responsibilities. There was a possible, right, on the part of the government, probably thanks to open and transparent information sharing and speedy release of data by the government, because that has helped build public trust vis-a-vis the government and health authorities. And on the part of the government, we have used data-driven and smart tech-based tools. For example, central and local governments in Korea are sending real-time alerts via text message, applications, and online on the number of confirmed cases of coronavirus, as well as the travel history of those who have been infected. There's an app called Self-Quarantine Safety Protection app, was developed by the government. With that app, people can identify and keep track of those infected persons' location to make sure they are not, also that the GPS data is also providing the government to track all those infected people, that they are not breaking their quarantines. Also, for example, that's when you'll be entering into Korea at the airport, these travelers, passengers must verify their addresses and contact information within Korea, and also they are required to download and install a mobile self-diagnosis app to keep track of fevers and other symptoms of possible infection while staying in Korea. And also, I think that's the public trust can be also built by the NGOs, civic community leaders, so that, well, that's kind of the public campaign to fully support these government policies, and also to take part in this social distancing policies, wash your hands, wear masks, and avoid any mass gatherings. So that kind of the responsible behaviors might have helped Korea to be relatively more successful than others.
Okay, so Korea doesn't have any maybe prevent market.
No, we do not have any regional or partial lockdown in any of the cities. Even Daegu city, which is so-called epicenter of that coronavirus at the very beginning, we haven't locked down the city of Daegu, and we haven't prevented or prohibited traffic in and out of Daegu city. So, but we have designated the city of Daegu as special care zone, where this all the medical and health resources have been concentrated into.
Good afternoon, Ambassador Kim. I hope you're doing fine. Hello?
Oh, yes.
Okay.
All right. Nice meeting with you once again.
Yeah, I'm Fajar from Jakarta Transportation Government. But actually, I have two questions here. And for the first question is about the public transportation in Korea. Is it still operate normally, or is there any changing about the operation of the public transport? And is there any new pattern of the travel of people in Korea within the city? And the second question is, well, we know that besides the needs to flattening the curve, we are need to anticipate further threat, which is like everyone say socioeconomic situation impacted by this coronavirus, and how Korean government handle with it. I mean, like technically, like how much the budget or national budget or provincial budget allocation to trigger the market or to give the direct aid for the people that really need it the most, that impact the most, and we know that in the early of the COVID breaks, the people in Korea also treat a positive person like uh, in negative way. I mean, it's like a shame to be a positive person, but right now, the people in Korea like accept it well, and I just want to know how Korean government educates the people, since we heard in Indonesia there are some community to refuse the remains body of the positive Korean because it is like a shame. Yeah. Okay. That's all. Thank you very much.
Oh, it's a very few questions you have raised.
I'm
All right,
sorry.
so yeah, Narelle, let me first get back to you on that first question.
Yes.
Korea's public transportation system are more or less an normal operation. So I think this Korea has one of the most effective and densely networked public transportation system. At the beginning, that there was a tendency for the commuters to ride their personal vehicles rather than riding on the public transportation like subway, metro, and buses. But now I think this is beginning to be back to normal in a sense, and of course there's the buses are advised to separate one passenger with another, so just one passenger on two passenger seats. So that kind of the small guidelines are now being applied. But this all in all, I think this public transportation is in full operation. And that's in order to tackle this economic kind of tsunami-like shocks from this coronavirus pandemic, then we have first is almost 40 billion US dollars this supplementary budgets to assist mostly small and medium-sized enterprises and mom and pop stores. I think there's another about 10 billion US dollars to be allocated for emergency medical and health needs. So those are the main two kind of economic packages that we have already introduced. Of course, there's if the situation is lasting longer than we do expect, then we might need additional stimulus packages to be adopted by the government. Thank you.
Korea is producing rapid test kit very fast. And how are you managing it? Is it under the government, or is it public holding, or is it something else? That's the first question. And the second one is that you mentioned about triple T, test, trace, and treatment. Could you please share more about the treatment? Because we all know that no medicine can cure this virus right now. But how can Korea maintain, the mortality rate very low?
Well, there's as I've said earlier, there's in Korea we are now using real-time PCR test for identifying this coronavirus infected cases. So we are not officially using this so-called rapid test kits, which are available here in Indonesia, because the PCR test is much more accurate in identifying the infection. And and then we, of course, that in Korea, we do have some companies who are manufacturing rapid kits, which are also being now exported to Indonesia. But officially for our KCDC, Korea Centers for Disease Control and Prevention, they are using PCR test kits through swab tests. And then our battle and preparedness of fight against coronavirus actually dates back to the late summer of 2015. You may remember there was another pandemic called Middle East Respiratory Syndrome, MERS, that has killed 38 people in Korea in that year of 2015. At that time, government was very much criticized for slow responses. And that outcry has been widely seen as a cause for regulations and actions that allowed for such a rapid response to this new coronavirus. With that, MERS, this Middle East Respiratory Syndrome experiences, we have reorganized this, the KCDC, Korea Center for Disease Control and Prevention. And also we have upgraded our medical system. We have equipped our medical hospital to be more sufficient to tackle these infectious diseases. So that has helped our Korean medical system be more effective than before, especially in comparison with 5 years ago. So that has helped a lot. Kind of the preparedness as is one of the secret of success. And of course, the civic participation that I've already shared with you is that the massive and voluntary participation by our people in general have helped us to slow down the spread of coronavirus.
Your Excellency, thank
Could
you.
move back a little bit and state your institution as well.
Okay. Thank you for sharing with us. I'm Alpha, social student from University of Indonesia. So this topic is about how Korea deals with COVID-19, and we know that South Korea is one of the countries that handle this pandemic very, very well. And I want to ask you what is President Moon's special policy in this pandemic, and how government build trust to the people of Korea? Thank you.
Thank you so much. Thank you for the question. Let me once again sum up what Korean government has undertaken in its fight against COVID-19. There's one phrase actually that's quite useful. There's a kind of the government strategy called trust, TRUST. T stands for transparency. R stands for robust screening and quarantine. And U, that stands for universally applicable testing. S, strict control and treatment, T. So trust, transparency, robust screening and quarantine, universally applicable testing, strict control and treatment. Those are the main points that Korean government has implemented while addressing this COVID-19 crisis. And out of these strategies, one kind of salient feature of our responses was holistic approach, kind of the joined up response to include every part of our decision-making process, not only central government ministries, but also all regional and provincial governments together. So the Prime Minister is now chairing this central anti-disaster task force, which is the control tower to tackle this COVID-19. But under him, there are not only ministers or the vice ministers, but also regional representatives like governors who are mayors of major cities. So it's kind of the all-in-one kind of the control tower. So they are working hand in hand. For example, when one area ran out of hospital beds, then we asked other provinces or the neighboring cities or the provinces to open up beds in their hospitals. So when one certain hospital, the regional hospital is running out of doctors, then the headquarters is asking doctors in other provinces, in other neighboring cities to help. So it's kind of the gotong royong type. It's kind of the helping with each other when a specific country, the region or area is in bad need. Then we could just reach out our help. Yeah.
My name is Jeff from School of Government and Public Policy, batch 6. Actually, I would like to ask 2 questions. First is, as we know, Indonesia right now facing the recessions of economics. So I would like to ask about the fiscal and the monetary policy that being conducted in South Korea during COVID-19 outbreak. So like, is there any printing the money or reducing tax, all this kind of things, something like that? And then for the second question is, in your point of view, what is the best policy for Indonesia beside trust, like you mentioned it before? So besides social distancing, lockdown, as we know that Indonesia is archipelago and there are so many cultures and religion here. So what is the best policy that will be conducted in Indonesia? Okay, thank you so very much.
Thank you so much. I think that you are quite right in pointing out the multi-dimensional crisis that we are now going through. Of course, the coronavirus, COVID-19, is primarily public health crisis, but at the same time, I think that it's financial crisis, and also it's a hugely negative unemployment shocks is affecting the job losses. And the final one is the whole disruption and hold of global supply chains and industrial foundations. So that this whole, the different type of crises are now almost taking place, coming to our shores at the same time. So that is something that we have to be prepared for. But for the fiscal and financial economic aspect, I think that I have shared some of the economic stimulus packages that we have already introduced, like $40 billion economic stimulus packages targeted at small and medium-sized enterprises and small mom and pop stores. And secondly, that we have dedicated, especially the dedicated about $10 billion to support medical and health sectors in an emergency situation like this. And then we are now talking about how to support the vulnerable groups in the society, about those who are below the level of middle income household, how to support them. And also we are now increasing our financial capacity to support temporarily unemployed people who are out of job due to this coronavirus. So those are the things that we are now working on, of course. But the best medicine to cure this COVID-19 is to put an end to this pandemic, right? So I think that's we are more focused on this minimizing the new cases as much as possible, and also to cure and release those who are already being hospitalized. And then the second question was about yes, one kind of recommendation for Indonesia, right? So so that is something I told you that there's no one-size-fits-all kind of solution. So a Korean model or Korea's case cannot be exactly emulated and duplicated here in Indonesia. But I think that's I feel that more information sharing in dire need on the location of infected patients, the number of tests carried out, and areas to avoid. And it seems still a lack of awareness and compliance among the public about social distancing measures. I think that is quite important. And of course, there's how to increase the level of capacity to test the people at risk. That's is quite primarily important task to be dealt with.
Okay, 안녕하세요, His Excellency. I would like to ask about scholarship. Due to the spread of COVID-19, is there any possibilities for scholarship, especially a global scholarship program, is cancelled or postponed? That's it. Thank you.
I think that Korean government's global scholarship program is still under process. I think there's the application deadline has already been over. So I think there's normally there's a face-to-face interview are being conducted before the selection of the candidate. But this year, because of this very peculiar and unique, unprecedented situation, I think there's the now screening process, selection process is underway only with documentation.
Okay.
For this year, but next year it will be different.
Yeah. Good afternoon, Mr. Kim. My question is, how does your government in Korea the way to overcome the outbreak in terms of online learning? I mean, do the schools in your country shut down as we do in Indonesia? And then how does the students deal with the material, with the lesson in their school? Thank you.
Yeah, we have closed down schools, and then tentatively we have the date for the reopening schools sometime, I think, the April 9th. But initially we'll be starting online class at the beginning. And now I think there's the schools are preparing, gearing up for preparation for online classes. And so that the smooth and proper online class will be provided for school children. And at the same time, this for those who are not not able or financially able to have those notebooks or the smart devices at home, local governments are now trying to come up with some support packages, kind of the rental of notebooks or the smart notepads for those who are in the vulnerable groups. So I think that those are the kind of the, and also we will be fully maximizing our EBS, education broadcasting system, which is on a nationwide coverage. And the school children are advised to watch that EVS this broadcasting.
Good afternoon, Your
Good
Excellency.
afternoon.
So my name is Amira. I want to ask you about talking about the COVID-19 pandemic. We're not only talking about the patient, of course, the economy, but also the social, the people who are affected, especially those who are vulnerable, elderly and disabled. I read on the news that some of the nursing homes for elderly in South Korea are closed due to preventive action because the elderly are having higher risk on affected by the COVID-19. So I want to know how does the South Korean government reach out to those who are vulnerable to ensure their well-being, protection, and maybe psychosocial support?
Yes, I was referring to this our government policy. We have not closed down any senior homes or the nursing homes, but actually there's we have temporarily closed down some of the nursing homes in which we have identified some confirmed infections. But other than that, we are trying to assist those hospitals or nursing homes to be more equipped with assistance and the proper medical kind of resources, and we are now providing this psycho kind of trauma kind of the
psychosocial support.
Yeah, that has been provided, now being provided by the local governments, and this. So it's in collaboration with the central government. Local governments are at the forefront of those the services to be needed for vulnerable groups and also those who are now suffering from some mental difficulties.
Hello, good afternoon, Mr. Excellency.
Yes,
could you speak up?
I'm Rebecca from California. And as Indonesia, with 2,273 COVID-19 cases by now, it's already along with 198 death cases. Meanwhile, South Korea, with 10,284 cases, only have 186 death cases. So I want to know, how did the Korean government take care of COVID-19 patients? Is there anything that Indonesia can improve to prevent any further possibilities of that cases? And furthermore, I want to know how Korea will overcome this crisis later on in the future. Maybe is there anything that in any way you could share regarding about the issue? Thank you so much.
So you are now from California, right? You are?
Sorry?
You are in California or?
Oh, sorry, I'm
in Indonesia, right? So you are yeah. So you are comparing the cases in the United States with Korea's case, right? So
no, sorry. So I'm comparing the cases, the death cases from Indonesia and Korea.
Oh, I see. Yeah. All right.
Yeah.
So it's our fatality rate is much below 2%, which is about 1.6%. Well, I think that's the key element of maintaining that low mortality rate is to do with that this trace, test, and treatment strategies. I think there's the speedy test will be ensuring our ability to trace and isolate the further infection and contagion, and also the speedier and much earlier treatment of those who are infected. So those three steps, 3T, test, trace, treatment, as one of the key elements. And another one is that our public health system is well established, so that the testing fees is free of charge. So, and then we have introduced drive-through testing stations, which is the first time ever to be introduced by Korea, and that model has been emulated by other foreign countries, and also even walk-in telephone booths like walk-in testing stations, which is much quicker. So every test at the hospitals, it takes about 30 minutes at least, or even an hour. But in case of drive-through testing stations, that we have cut the time up to less than 10 minutes. Even the walking booths like testing station, which is more innovative, that is less than 5 to 6 minutes. So I think that's in order to cope with this fast traveling viruses, we have initiated this kind of speedy testing tools. And perhaps here in Indonesia, so those who are being confirmed as new cases are a bit much fewer than Korea's number, but the mortality rate, fatality rate is very high. So which I think that we should address. Of course, that's with that increasing capacity building for testing abilities, but at the same time to beef up intensive care units within the hospitals, and also try to provide more medical equipments and systems and items for frontline medical workers. I think that's at this point, I just want to share with you that we should pay respect and pay great respect to frontline medical and health workers. They are the warriors. They are so-called heroes at the front line of our battle against COVID-19. Thank you so much. Thank you for the invitation. I think that's it's quite useful for me as well, that I could learn through the questions. I think there's some of the points of interest from our Indonesian friends. I think there's, I just want to assure you that there's no single country to cope with this global pandemic alone. I think that we should stay together, work together, and overcome together. That's our spirit.